Let's learn about the blood supply of nasal septum. Knowing the anatomy and blood supply of nasal septum is of foremost important because many people presenting with the complaints of epistaxis, more than 50% of the population, the most common nasal complaint will be epistaxis, more than which is also called the nasal bleeding. The most common site for the epistaxis in case of children and young adults or the Little's area or the Kesselblack's plexus. Let's see this Little's area or Kesselblack's plexus. This area, which is the seen in the antero-inferior part of the nasal septum, which is seen just behind the vestibule of the nose. It is highly vascular and it is formed by the anastomosis of four blood vessels. Gets anastomosis at the site and it forms a rich vascular supply at that area, and that becomes the uh, most dangerous part for anterior epistaxis. This cause of epistaxis is because of dried inspired air, and this also get easily traumatized when the child have the habit of nose pricking. The four vessels which get anastomosis at this Little's area or the Kesselblack's plexus are superior labial artery, greater palatine artery, sphenopalatine artery, and anterior ethmoid artery. This is of foremost importance and it is asked in many competitive exams, and this can be remembered with the mnemonic GRASS. We may remember this as little grass. Little grass, which is the components of Little's area. Here GR stands for greater palatine artery, and A stands for anterior ethmoid artery, and S stands for superior labial artery, and other S stands for sphenopalatine artery. These are the four arteries which anastomose at this Little's area, and it forms the highly vascular anastomosis there. Coming on to the branches, mainly this branches greater palatine artery, anterior ethmoidal artery, and superior sphenopalatine artery are the branches of external carotid artery and internal carotid artery. Let's see, this is a common carotid artery. It is divided into external carotid artery and goes above as internal carotid artery. The internal carotid artery with the branch ophthalmic artery, it is further divided into anterior ethmoid artery and posterior ethmoid artery. These two arteries supply the superior part of the nasal septum. Both anterior and posterior superior part of the nasal septum is supplied by the ophthalmic branches of internal carotid artery with the anterior ethmoid and posterior ethmoid artery, among which anterior ethmoid alone forms the component of Little's area, whereas the posterior ethmoid is not formed. Posterior ethmoid is not the component of Little's area. It is different from the Little's area. It will not anastomose in the Little's area. Whereas in the external carotid artery, which is further divided into facial artery and maxillary artery. Maxillary artery, which is in the posterior, is further divided into sphenopalatine artery and greater palatine artery. Sphenopalatine artery plays the major role and it supplies major part of the nasal septum. So the sphenopalatine artery is also called the artery of epistaxis. This sphenopalatine artery and greater palatine artery, which are the branches of maxillary artery, supplies the postero-inferior part of the nasal septum, and it also forms the component of Little's area. The facial artery, which is a branch of external carotid artery, which again divides into superior labial artery and further which supplies the Little's area. This is meant for the antero-inferior part of the nasal septum and also contributes to the Little's area.